Hello, everyone. My name is Nicole Merkowitz. I'm an occupational therapy student at the University of North Dakota, and this presentation is about my capstone project titled Sex, Drugs, and Rockin Referrals, an interprofessional guide for young adults with cancer. So just as a disclosure to the learners, CentraCare is approved as a provider of nursing continuing professional development by the Wisconsin Nurses Association, an accredited approver by the American Nurses Credentialing Centers Commission on Accreditation. Successful completion requirements. In order to receive 1 contact hour for this activity, you must complete and submit the evaluation form. I was not paid to give this presentation, and there has been no commercial support either. So like I said, my capstone project is titled Sex, Drugs, and Rockin Referrals, an interprofessional guide for young adults with cancer. I think it's important to explain the meaning behind the title. So it's an interprofessional referral guide for health promotion and management with an emphasis on addressing sexual health. It's intentionally named to be playful and to also challenge social norms. So then the objective of this presentation is to understand the unique needs of adolescent and young adults with cancer and learn about the purpose of Sex, Drugs, and Rockin Referrals, an interprofessional guide for young adults with cancer. So some key terms and concepts used throughout this presentation include health management, and this is defined by the Occupational Therapy Practice Framework, activities related to developing, managing, and maintaining health and wellness routines, including self-management with the goal of improving or maintaining health to support participation in other occupations. And an occupation is anything that a person needs and wants to do. So it's very broad. An adolescent or young adult is an individual within the ages of 15 to 39. And the interprofessional team consists of team members from 1 or 2 or more professions that collaborate and learn from each other to promote holistic care for patients. And then sexuality is defined as gender identities and roles, sexual orientation, intimacy, and reproduction. Sexual activity, again, is defined by the AOTA PDF, engaging in the broad possibilities of sexual expression and experiences with self or others, such as hugging, kissing, foreplay, masturbation, oral sex, and intercourse. And then sexual health is defined as it encompasses physical, mental, emotional, social well-being concerning sexuality. It's important to note that it's not just the absence of disease or dysfunction, and it also requires a positive and respectful approach to address sexual health effectively. So then this table and slide describes the main parts of the title, the need of, according to research, and then the solution my product gives. So the first need is that conversations about sexual health and activity are not happening consistently. So to help address that, I used the recognition model, and then I also created an OT-directed in-service to address this need. Drugs refers to the medications and treatment methods used to treat cancer. And then the medications and drugs also have long-term side effects that affect sexual functioning and just overall well-being. So then my solution to meet those needs and address those long-term side effects from cancer treatment is a referral checklist that I'll describe later in this presentation. So then the Rockin Referrals and the Interprofessional Guide, there is a need for patient-centered care as well as a collaborative team environment within the interprofessional team. So then my solution is to provide an interprofessional team and role diagram, as well as use the referral checklist. And then young adults with cancer. AOA patients with cancer have unique needs compared to pediatric and older adults. So then my solution is that this product is designed to meet the needs of patients ages 15 to 39. My Product was guided by this problem statement. So according to the National Cancer Institute, 89,000 AYAs are diagnosed with cancer each year. This accounts for about 5% of all patients with cancer in the United States. However, 56 to 75% of AYAs who could benefit from OT do not receive services. So this stat paints a picture of OT alone, but we know that AYAs with cancer do not receive the services in general that they need, so the supportive allied health referrals. So this chart describes the occupational impact of cancer treatment. So there's a wide variety. And like I said, an occupation is anything that a person needs and wants to do throughout their day. So things directly affected by or for AYAs with cancer include developmental transitions, sexual activity, sleep and rest, health management, eating and swallowing, toilet and toilet hygiene, personal hygiene and grooming, and work and school. However, it does encompass a broad occupations, but my particular project addresses sexual activity and health management with acknowledging developmental transitions. So this is how OT can help AYAs with cancer. So the different intervention areas include health management, lymphedema, cancer-related fatigue, cancer-related cognitive impairments, return to school and work, chemotherapy-induced neuropathy, and prehabilitation, and then address psychosocial needs. Occupational therapy has a really broad range of ways we can support AYAs with cancer. So this is a nice diagram that explains that. So the first part of my project was completing a needs assessment. And this was done through observing various disciplines at the facility. So I talked to social workers, oncology nurses, medical oncologists, radiation oncologists, palliative care, just to get their perspective and to learn more about their role within the cancer center. I also had conversations with stakeholders, which included young adults themselves to learn more about what they would like to see and areas of need that they're experiencing, as well as oncology nurses. I also attended young adult patient committee meetings once a month to, again, learn more about the need and how I can help both the facility and the patients. And lastly, I observed some OT lymphedema evaluations. Lymphedema is a common long-term side effect that many cancer survivors encounter, and it's important to address that aspect early on. And I also completed a literature review. So these are some key findings. AYAs encounter unique challenges due to developmental milestones and models of care. So the age range of 18 to 39 is a time of many developmental transitions, such as graduating high school, going to college, finding a first job, dating, marriage, raising a family, and just overall finding more independence. And for someone without a cancer diagnosis, these things can be difficult to navigate. So cancer just adds another layer of complexity. Just as you're finding who you are as a person and gaining more independence, you all of a sudden have this life-threatening diagnosis. And then it's also common for AYAs to be diagnosed with cancer that is common in pediatrics. But then they receive treatment in a pediatric setting or a geriatric setting. There's not really a model of care that is directed for AYAs. And the models of care used for pediatric and geriatrics, they just don't meet the needs due to those developmental milestones that young adults are trying to navigate. And then side effects from cancer treatment impact all occupations. This can be anything from social participation to sleep and rest, and then also sexual activity. Speaking of sexual activity, healthcare providers are typically uncomfortable talking about sexuality. This can be due to social norms, to our own thoughts and feelings, values, morals about addressing sexual health with patients. And then lastly, there is a need for interprofessional collaboration to address patient needs, for patient-centered care, and also just a holistic aspect. So some barriers of care, according to literature, include a lack of AYA-specific programs. There are limited opportunities to interact with other adolescents and young adults just due to the incidence numbers of having a cancer diagnosis in adolescence and young adulthood. Adolescents and young adults also have difficulty navigating the healthcare system. It could be new to them. They may or may not have insurance, and those are all things that impact their overall experience and well-being. There are also limited resources and access to allied healthcare for AYAs with cancer. Physicians may be less familiar with AYA cancers, and AYAs have a limited awareness of long-term effects. The feeling of invincibility is common for adolescents and young adults to experience, which can lead to a delay in diagnosis, again, limited awareness for long-term effects. So it's important to provide that education about symptom management early on. The interprofessional team also plays a valuable role in cancer treatment. So some ways we could improve are proficient ways to screen and diagnose cancer, the use of psychosocial assessments, because cancer is not just a physical thing. It affects the psychosocial aspect, mental and emotional health. And we can also gain an understanding of what the patient wants and needs are from treatment. And then again, provide education about long-term effects. So this chart describes how I created my product and what the needs are and how I address it. So again, the overall occupational focus is health promotion and management. And then according to the literature, there were needs to address sexual health, interprofessional collaboration, and referrals. So for sexual health, I created a recognition model handout and an OT-directed in-service that explains how to address sexual health and just helps the healthcare provider feel more comfortable. And then for interprofessional collaboration, I created an IP team diagram and then a roles diagram. And then for referrals, I created a referral checklist that addresses medication side effects, procedures, and ADLs and IADLs. So again, my product is Sex, Drugs, and Rockin Referrals, an interprofessional guide for young adults with cancer. It's an interprofessional referral guide that is focused on the broad occupation of health promotion, while also addressing sexual health side effects, procedures and medication side effects, and any ADL or IDL concerns that the patient may have. So the purpose and objective of my product is to enhance health promotion for AYAs through interprofessional collaboration and prehabilitation by improving consistency of sexual health conversations, addressing side effects of medications and procedures, and providing referrals within the interprofessional team. So my product also uses the concept of prehabilitation, and prehabilitation is just a proactive approach and provides education about symptom management before the patient experiences those symptoms to hopefully improve quality of life. So again, the benefits of prehab are to include or to improve psychological functioning, physical functioning, health outcomes, and interprofessional collaboration, while also reducing treatment-related impairments, risk for comorbidities, and healthcare costs. So again, by addressing the side effects before the patient experiences them, they should reduce healthcare costs and just improve overall well-being. I also use theory to create my product. I use the Ecology of Human Performance model, also known as EHP. It's not a specific OT framework, and it actually supports interprofessional collaboration. And since that is a need, I thought it would be most appropriate to use EHP. And I also use a recognition model. And the recognition model walks the healthcare provider through navigating a conversation about sexual health. So the product description, it's an interprofessional referral guide for health promotion in young adults with cancer. There's 5 components, which include an interprofessional team diagram, an interprofessional roles diagram. Now let's talk about sex and introduction to the recognition model, an OT-directed educational in-service to the interprofessional team, and a referral checklist. All right, so this is EHP applied to the interprofessional team. So the person includes the interprofessional team and their roles. The tasks include initiating a conversation about sexual health, addressing patient needs, and then providing referrals. The context is the collaborative environment of the interprofessional team. So then for areas of need, sexual health and activity are often overlooked in a clinical setting. And then there also needs to be a conversation about the long-term effects from treatment with patients. As for barriers, this could include a lack of understanding of who is all involved in the interprofessional team, as well as their roles. There has been a limited number of referrals for patients, and then sexual health is not consistently addressed. However, there are various disciplines within the interprofessional team to provide holistic care. So then the first part of my product includes establishing the interprofessional team. Again, EHP says that the person includes the interprofessional team. The context is working as a collaborative team to provide patient-centered care. And then the hopes of this section is to establish the roles of the interprofessional team. And this diagram serves as a quick reference tool. So this is my concept map that I made of the interprofessional team at the facility. So the professions that I included are oncology, rehab, sexual medicine department, the healing center, the dietitian, social work, and pharmacy. And from there, we have different disciplines within the larger umbrella. So again, this is used as a referral guide and a good visual tool to use when making referrals. So then the second part of my project is establishing interprofessional roles. So this is again for the interprofessional team and to support team collaboration and environment. So the goal is to establish the roles of each discipline to promote a collaborative and interprofessional environment. Again, it's a quick reference tool and it complements the previous diagram. And then another diagram also describes the value of OT services throughout the care continuum. So this is my roles diagram. It's also found within my product. I color coordinated a few of the disciplines. So teal is for rehab, and then sexual medicine department is in blue. And the other one just gave like an overview of everyone who is involved. On this one just has a brief sentence to describe what the role is of each discipline. So this is my OT chart that I made to describe how OTs can help AOAs with cancer throughout the care continuum, so all the way from diagnosis to end-of-life care. So during the diagnosis stage, OTs can provide early therapeutic intervention, coping strategies, relaxation techniques, and self-advocacy skills. OTs are also skilled at providing rehabilitation strategies. And then moving on into treatment, we can work on self-management techniques, ways to manage fatigue, pain, and neuropathy, how to return to school and work, ADLs and IADLs, cognition, social engagement skills, and adaptive equipment. And then moving on into survivorship, we can suggest environmental modifications as a young adult returns to school and work. Again, focus on self-management strategies, health management, and social and leisure engagement. And then for end-of-life care, this can include legacy completion, family training, and adaptive equipment. All right, so this is my portion that is called Let's Talk About Sex, the introduction to the recognition model. So this is for the interprofessional team, and the task is to initiate a conversation about sexual health. The area of need is that conversations about sexual health should be happening consistently. However, navigating a conversation about sexual health can be intimidating. However, with time and practice, comfortability and confidence can increase. The goal is to establish and restore the skills needed to navigate a conversation about sexual health, while also preventing negative outcomes by initiating these conversations about sexual health consistently. So the materials included within this section include a recognition model handout and an OT-directed in-service about sexuality and cancer care for young adults. So first, let's talk about sexuality and cancer and just how those two interact together. So cancer has a psychological and developmental impact. And then many chemotherapy regimens used to treat cancer can cause infertility. And this is a big concern for AYAs. At this point in time, when they're 18 to 39 years old, they may or may not want to have kids in the future. And that's a big question for someone who is 18 years old. So cancer treatments can also affect the level of sexual desire, arousal, and overall satisfaction of sex. And then sexuality impacts several areas of everyday life. Social roles, occupation, it is an activity of everyday living, well-being and safety, and identity. It's also common for AYAs with cancer to experience a change in relationships. So if they have a significant other, it's common for them to feel like the relationship isn't as close as it once was. And then a cancer diagnosis can also impact the ability to build a long-term relationship, to even start dating or continue dating, and then marriage as well. Despite the importance of sex, sexuality, and fertility, many healthcare providers are uncomfortable talking about these topics. However, not addressing these topics only increases a patient's anxiety, depression, and stress levels. It's also important to note that young adults with cancer want information about sexual health and what they can expect. So as healthcare providers, we have to take the responsibility to give the information that they're looking for. All right, so then I use the recognition model to address the area of need, which is sexual health and activity. It's common for various drugs and procedures to impact sexual health and functioning as a young adult goes through cancer treatment. Social norms often influence how healthcare providers are having conversations about sexual health, as well as a consistency. Cancer also has a significant impact on emotional, mental, and physical health as well. So it's a big deal. So the importance of discussing sexual health. It's common for patients to wait for healthcare providers to initiate the conversation. And then healthcare providers wait for patients to talk about what they're experiencing for side effects. So it's not really effective for us to be waiting for the other one to bring up the conversation. It's also difficult to navigate a conversation about sexual health, and that can be a huge intimidating factor for many healthcare providers. There's a way to do it professionally, and then to be prepared to navigate that conversation is another can of worms too. However, with practice and time, the healthcare professional can begin to feel more comfortable addressing sexual activity with patients. So this is an overview of the recognition model. A full handout is located within my product, but I'll just briefly go through the stages here. So stage 1 is acknowledging that the patient is a sexual being and therefore has sexual needs. Stage 2 is gathering permission to talk about sexual health with the patient. And then stage 3 is exploring their concerns. Stage 4 is addressing their concerns within the interprofessional role that you have. And then stage 5 is providing referrals. And for this product, I included referrals to sexual medicine department and occupational therapy, of course, depending on their needs. So stage 1, recognizing that the patient is a sexual being. During this stage, it is important to normalize, provide affirmation, validation, and then recognize your limitations as a healthcare provider. So then I made some sample scripts that I'll briefly go through. Feel free to use them or tweak them a little bit to meet your needs and whatever makes you feel comfortable. So the first one is that many young adults have concerns about how cancer treatment could affect their sexual health and activity. This is an important aspect of life, and I want you to know that there are resources available if needed. So throughout that statement, I provided things that normalize their concerns, provided affirmation and validation, and then recognizing the limitation that there are other resources that can better address their concern if necessary. Then here's another one. Sometimes young adults feel like they don't get enough information from their providers about sexual health. It is also common for patients to feel like cancer has affected their sense of intimacy or romantic relationships. Often, these issues are treatment related, or there may be other things we can do to help. So again, providing statements that normalize, provide affirmation and validation, and then recognize the limitation. All right, stage 2 is gathering permission to talk about sexual health with the patient. So this can be done after you say the script from the last one, just by saying, what concerns do you have at this point in time? If the patient does not have any concerns, you can address certain side effects that the patient could be watching for. Or if the patient does have concerns, we would move to stage 3. And stage 3 is exploring concerns. We want to do this by using open-ended questions. I'm using empathetic listening skills, and then acknowledging the impact on relationships, identity, and then lastly, wanting to thank the patient for sharing. This is a topic that is scary to bring up, and it's difficult for providers to initiate that conversation. So we just want to acknowledge the patient's vulnerability and willingness to share with us. All right, so then next we're going to address the concerns within the scope, or we're going to refer on. So stage 4 is addressing the concerns within the interprofessional team. And then stage 5, providing the referral. This would include gathering more information and providing education, and then use clinical judgment and recommend a referral as necessary. And again, have that conversation with the patient of what their true needs are, and then talk to them about providing a referral. Right, so if we're going to provide a referral, it's important who would be the most appropriate to refer to. So like I said, for this presentation, I included the sexual medicine department and OT, but for the sexual medicine department, it's made up of several different disciplines that work together as a team. So starting with OBGYN, they specialize in women's health. Urology is urinary tract and reproductive conditions. Certified sex counselor and advanced practice registered nurse. She specializes in counseling and treatment of conditions that affect sexual functioning. Some intervention strategies that she could provide include education, lubricants, dilators, meditation strategies, mindfulness strategies, counseling, and medications. And then lastly, we have pelvic floor physical therapy to strengthen the pelvic floor muscles. Interventions include manual therapy, various exercises, dilators, stretches, mindfulness strategies, and pain management strategies. right? So this is how OT can help with sexual activity. So the biggest thing that is going to impact sexual activity from an OT perspective is cancer-related fatigue. So as OTs, we would address cancer-related fatigue first, and then come up with ways to help the individual engage in sexual activity as they wish. So some interventions include different strategies for positioning, energy conservation strategies, communication strategies, adapting and modifying tools, and then providing stretches for range of motion, endurance, and strengthening as well. So this is the handout that I made for the recognition model that can be found within my product. So it goes through all the different stages, provides key phrases and things to think about as you're navigating a conversation with sexual health, and then how each discipline can help the patient with their sexual health needs as well. All right, so then the last part is the referral checklist. Again, applied with EHP. The referral checklist is for any young adult patient, ages 18 through 40, who is undergoing cancer treatment. I tweak the age range a little bit just due to the needs of the facility to meet their needs. And then it's also for the interprofessional team. So the young adult will complete the checklist and the interprofessional team will provide the referrals. The overall goal is to establish referrals for young adults, establish areas of need, restore performance skills needed to engage in meaningful tasks, and then prevent negative outcomes by providing referrals and initiating conversations about patient needs. So included materials within this section of my project include a referral checklist introduction, a referral checklist meant for young adults, then a referral key for the provider through an EHP table that explains the purpose of it, and then referral forms for young adults and young adults with breast cancer. All right, so this is a quick intro to the referral checklist. Again, it's meant for health promotion. And it would be best for the young adult to fill out the form 3 times throughout their treatment. So at diagnosis, treatment, and survivorship. The reason why it would be beneficial for them to complete the form more than once is to monitor changing needs over time. Oftentimes you don't know what you don't know until you experience it, and then you don't really remember who to reach out to. So we just want to make sure that we're meeting those needs as they go through the care continuum. The referral checklist should be available via my charts for the young adults to fill out, and then the healthcare provider to access and address their needs. So then the time needed is only about 2 to 3 minutes to complete. It's pretty simple. So then this is my referral checklist. It includes addressing procedures such as chemotherapy, radiation, and surgery. And then it also asks, like, when did you start chemotherapy? And then asks for locations for radiation and surgery. And then it also addresses medication side effects and ADLs and IADLs. So this is what it looks like. It again can be found within my product. Procedures, the chemo, surgery, and radiation, and then the location and start date for chemo. Medications, it asks about what side effects your medications currently have. I grouped similar symptoms together. And then with yes, no, or unsure, if the patient circles unsure, would be a wonderful opportunity for patient education. And then whether they are experiencing those current symptoms or not. And then any ADLs that they have concerns with currently, anything from sleep to financial management. And then based on conversations of what exactly they have concerns with would trigger a referral to another discipline. And it also provides a space to provide additional comments about their concerns. Right, so then this is EHP applied to the providers and the referral key. So it's for the ordering providers and the disciplines that they are referring to. It addresses potential side effects for medications and procedures. The tasks are ADLs and IDLs that are impacted due to certain side effects. I included the context as inpatient and outpatient environments. And then we want to prevent negative patient outcomes by providing referrals within the interprofessional team throughout treatment. And then improve patient side effects and promote engagement in meaningful tasks. All right, so this is what it looks like for the provider. Again, it addresses procedures and ADLs and IDLs. So we have the ordering provider and the discipline referred to, as well as the setting. And then medications, again, the side effects. The side effects are the same as the version for the young adults. So again, this is what it looks like. I realize it's a lot of words on one slide, but I thought it was important to show you. Again, it's found within my product. So we have the procedure. Will the patient have a procedure in the pelvic region? If yes, provide a referral to the sexual medicine department or occupational therapy according to their need. So we have ordering providers, the person, the discipline that they're referred to, as well as the setting. The main difference between this form for young adults and the one for breast cancer patients, the OT is a CLT, and there's also an option for a physical therapy CLT as well. So that's just something to keep in mind. And then medications addressing potential side effects to promote preventative care as early as possible, provide a referral and or education. So these are all the same side effects that the patient has on their form, and then if they're currently experiencing them or not. And then possible referrals for ADLs and IDLs. Again, the ordering provider, the discipline referred to, and then the setting. So there it is in a nutshell. All right, so once the form is completed, an oncology nurse will initiate a conversation about sexual health. And it's important to initiate that conversation about sexual health regardless of whether the patient indicates it as a need, just to make sure that it's consistent and it's an opportunity for them to know that even if they aren't having those symptoms right now, they know who to talk to in the future. And then discuss side effects from procedures and medications, discuss patient concerns, then provide referrals to the interprofessional team. All right, so then in order to implement this product, I thought it would be best to start with young adults with breast cancer. The reason behind this is that there is an established team of RN breast cancer care coordinators who are familiar with the side effects of medications specific to breast cancer. A lot of hormone therapy treatments affect different symptoms, such as like premenopausal symptoms, and they may be more comfortable addressing sexual health with patients just due to their experience. In addition, patients with breast cancer also make up a large population of patients seen at this facility, and then just starting with breast cancer care coordinators who might be more comfortable addressing sexual health, but also targeting a bigger population of patients would help reach a wide variety of patients. So then once we're comfortable, the product can be used to reach other populations as well. All right, so then I wrote a case study to just kind of illustrate how this would really work in practice. So here we go. So this case study is about Lindsay. She's a 28-year-old female. She noticed a right breast mass while she was showering. They diagnosed it as breast cancer, specifically invasive ductal carcinoma. It's stage 3, it's 5.5 centimeters, and spread to 2 axillary lymph nodes. She started chemotherapy, hormone therapy, and is 4 weeks post double mastectomy. And then she will soon start radiation. Some other things that are important to note about Lindsay is that she is married. She has 2 kids, a 3-year-old and a 6-month-old. And she works as a secretary at an elementary school. So then the process begins. So Lindsay would fill out the referral checklist while waiting for her appointment. And then according to how Lindsay filled this out, the procedure sections include that she is having chemotherapy. The start date was March 1st. She had surgery and it was on her chest, and she will be having radiation again on her chest. The side effects that Lindsay indicated include an increased risk for bleeding, bruising, and infections, hair loss, skin and nail changes, lymphedema, edema, and neuropathy, fatigue and sleep problems, and symptoms related to sexual health. And then lastly, for ADLs and IDLs, Lindsay mentioned sleep, sexual activity, bathing and showering, childcare, social participation, and financial management. As for additional comments, she wrote that I am often too tired to do the things I enjoy. I don't feel like myself because I lost my hair. I don't know how to pay for treatment. So this is what it looks like from how Lindsay filled it out. So I highlighted the chemotherapy, again, the location, side effects that her medications have, and whether or not she's currently experiencing them, the different areas she has concerns with, and then her comment at the bottom. So then the role of the healthcare provider in this situation is to use open-ended questions to gather more information about the true concerns that Lindsay has. So this can be done through a statement that starts with, tell me more about blank. When did you first notice the symptom? And then how long have you been experiencing these symptoms? And then it's also important to address sexual health. And this can be done by using a phrase that we used earlier with the recognition model. So sometimes young adults feel like they don't get enough information from their providers about their sexual health. It is also common for patients to feel that cancer has affected their sense of intimacy or romantic relationships. Often these issues are treatment related, or there may be things we can do to help. So again, the normalize, the affirmation and validation, and recognize limitations. So by asking more open-ended questions and gathering permission to talk about sexual health, the healthcare provider discovered that Lindsay is bruising more than normally. She is bothered by the loss of her hair and has numbness and tingling in her fingers, and she has been experiencing that for about a month. She has been tired since she started treatment, and sleep does not help her feel rested. This impacts her ability to be able to take care of her kids, and she has no energy to take a shower, and that's something that's really important to her. She's also experiencing decreased libido and vaginal dryness, and this impacts her relationship with her husband. So this chart describes a symptom as well as possible referrals and interventions. So since Lindsay is bruising more than normal, it would be important to provide patient education. And then since she is bothered by the loss of her hair and the tips of her fingers have been numb or tingling for about a month, some referrals could include integrative therapy such as support groups, and the enhancement program, as well as acupuncture. And then a referral to occupational therapy, specifically a certified lymphedema therapist, to address effects of radiation surgery and cancer treatment in general. It's common for lymphedema to be a long-term side effect, so we have to address that early on to maximize function and all that kind of good stuff. She has been tired since she started treatment, and sleep does not help. Occupational therapy is another good referral to address cancer-related fatigue, and then integrative therapies, again, acupuncture could help with sleep. So Lindsay does not know how she will pay for treatment and her other bills while going through cancer treatment. So this would be addressed through social work or a case manager. Lindsay is also experiencing decreased libido and vaginal dryness, impacting her relationship with her husband. And this could be addressed by the sexual medicine department, such as an OBGYN or a certified sex counselor. It's also important to note that patients may be more comfortable starting with an OBGYN and then referring on to a certified sex counselor as necessary. Insurance could also play a factor into this, and that's just something to think about, have that conversation with the patient, and go from there. So this is what the form would look like for the provider. Since Lindsay is a breast cancer patient, she is at risk for lymphedema. So that's why I highlighted an occupational therapist, specifically a lymphedema therapist. And then you only have to refer to OT once. So if you circle it up here, you don't have to circle it again down here. That'd be counterproductive. So that's that for that section. And then for medications, address potential side effects to promote preventative care as early as possible, provide a referral and or education. So the nurse would provide education about the increased bruising that Lindsay is experiencing, and then highlighting other symptoms that she is experiencing as well. And then as for ADLs and IDLs, a case manager can be completed by a nurse, that referral, again, in an outpatient setting. And then a referral for an OBGYN in an outpatient setting, and integrative therapies as well. So again, that's how this process works. Have that conversation with the patient about what referrals and disciplines are available, and then go from there. So there we go. All right, and there are some limitations to this product. It's a small population to begin with, but that doesn't mean that it should be ignored. It's important to have those resources and tools available to address the needs of all populations. It would also be common for patients to refuse referrals just due to exhaustion with other medical appointments, and there's life outside of cancer treatment, and that's important to acknowledge as well. However, patients need to know that if they are having symptoms, we can provide referrals as well. Logistics of referrals, this is typically applied to OT and what I know about it, but the OT department at the facility typically deals with patients who have TBIs, and there's a couple lymphedema therapy specialists who can help patients with cancer, but it's just important to acknowledge that logistic aspect. And then comfort level when addressing sexual health. And that's an external factor of the healthcare provider. So like I mentioned, social norms play a big role in addressing sexual health, our comfort level, and our morals and values. And then the referral checklist has not been piloted with any patients. There's a lot of background work that I did to make sure that healthcare providers are comfortable talking about sexuality and sexual activity before we use the referral checklist with patients. So gotta take it one step at a time, but the referral checklist is there and ready to use when staff is ready. I would also expect that there might be some changes to be made, and that's perfectly okay too. All right, so then as for my recommendations, it would be recommended to adapt the referral checklist to be used with older adult patients. The mental health referrals. Like I said, cancer is not just a physical experience, it also affects psychosocial, mental health, emotional health, things like that. So that would be another way that this referral checklist can be improved. It would also be important for the referral checklist to be in an electronic format to make it easy for the patient to fill out and the healthcare provider to use and access. And I also recommend additional culture and diversity training for healthcare providers to meet the needs of the LGBTQ+ patients. All right, so then assessing outcomes of the product can be done through patient satisfaction, the overall number of referrals given on the annual report, the interprofessional team reflection, how this is working for them, what can be done and what can be improved. And then Commission on Cancer standards. So my project I think it met 2 standards, referrals within the interprofessional team, as well as continuing education credits. All right, so then as a summary, a cancer diagnosis in adolescence and young adulthood affects many occupations and developmental milestones. Interprofessional collaboration is important for patient-centered care and health promotion. And sexual activity is an ADL and needs to be addressed consistently in clinical settings. All right, so then this is the QR code for my OT-directed in-service that talks about the recognition model. It's about a 7-minute YouTube video that goes through what we talked about today, but just as an additional resource for more information about how to use the model to address sexual health. All right, and then these are my references that I used to create this PowerPoint. All right, so thank you for listening.